they do not take post-operative X-rays, especially when it goes for consultation. Pre-op எடுக்கிறது இல்ல. ஃபைல் போட்டுட்டுனா ரொம்ப லூசா போகும் 15 size ஃபைல்னா அது ஏற்கனவே ரிசார்ப்ஷன் இருக்குன்னு அர்த்தம். அது கூட we will not know. Ideally speaking, you will have to take a pre-operative and post-operative X-ray. At least for seal பண்றதுக்கு முன்னாடி when you obturate, check whether it is at the apex or extruded. Extrudedனால தப்பிக்கலாம். But under arrest you will have to fill. அந்த மாதிரி ஓவர் எக்ஸ்ட்ரூஷன் ஆகி ஆப்ரேட் பண்ணீங்கன்னா you will not get it.
Post-operative X-rays are very, very useful.
One more thing. One more important thing. Pediatric idle. You should irrigate properly. அது வந்து நம்ம primary treatment ல பண்றதே இல்லை. It is all saline here. Primary எடுத்துட்டா it is what the notion that sodium hypochlorite should not be used. Or chlorhexidine வேண்டவே வேண்டாம். Child ஓமட்டா பெரிசா போயிடும் வீக் வந்துடும். You will have, there is a technique which we will tell you how to use it. It is drop technique. But after each instrumentation, you will have to use saline. Mandatory or 2 ml saline after every instrument. 15 size K5 போட்டிங்கன்னா irrigate with 2 ml. 20 size போட்டிங்கன்னா irrigate with 2 ml. அப்படி பண்ணால் மட்டுமே you will have a good observation and no post operative.
நமக்கே தெரியும் நம்ம என்ன பண்ணிட்டு இருக்கோம். எல்லா கேஸ்க்குமே post operative X-rays எடுக்க ஆரம்பிச்சோம்னா we know what's happening. Class 2 fillings-ல கூட post operative X-ray எடுத்தோம்னா எப்படி பண்ணிருக்கோம் தெரியும். ரொம்ப டிஃபிகல்ட்டா அந்த கிரவுண்ட் சீட் பண்ணோம்னா கூட X-ray எடுத்து பார்த்தா எங்க உட்கார்ந்திருக்குன்னு தெரியும். Always for our own benefit we should take and begin. Any questions from the floor here? Anybody else wants to ask any questions?
Yes, sir. This article injection for less than 4-year-old concept is gone, sir. It's still used now. But always better than injection you give for infiltration than a block. It is working. Especially who are going for crown. You can give a spray or you can give a small article infiltration if you want to make it.
Actually, block is not needed. Articulate has a good penetration, can diffuse into cortical bone. So
Mandible also.
Adult decay infiltration helps to some extent. So block it
but I'm telling it for the crown and this way. But pulpitally you might give a block. You might not. Pain, you put the parallel if it is not going.
So why can't articulate? Articulate will give you that efficiency.
It is there are studies. Studies wise holding na 2% lignocaine, 4% articaine for the block. Articaine is 4% articaine.
Articaine duration of action, penetration, ellame it is better. But only thing is articaine use பண்ணும்போது we should know the cardiovascular status of the patient. It is contraindicated to cardiovascular conditions in the patient. And you cannot use more than 2 cartridges. It's not advisable. 4 ml க்கு மேல articaine you should not use. Lignocaine வந்து block கொடுக்குறோம் அப்புறம் infiltration கொடுக்குறோம் அப்புறம் block repeat பண்ணி 4 syringe வரைக்கும் 5 syringe வரைக்கும் we give. But in articaine you should not go more than 2. It is not advisable.
This efficiency, don't you think within 2 packages it will work?
It will work, sir. If given correctly, it will work. But you should be very careful when you handle the quantity. So 1.7 ml is the cartridge quantity. So you can go up to 3.4 ml. Adhik mala we will say it is not advisable. On books, yes, you can go more. But clinical or 2 cartridge mala not advisable.
You are telling about the cardiovascular status. Is there any particular cardiovascular condition or general?
Generally, they say cardiovascular conditions of the patient is better to avoid articaine. It is also with epinephrine. So it doesn't come plain. Plain articaine is not there. It comes with 1 in 1 lakh epinephrine.
One question you know. What is the 3 practical mistakes?
அதுக்கு முன்னாடி மக்கள் ஓபன் பண்ணிட்டு லாஸ்ட் I want to finish with this. Quick
I'll answer the 3 mistakes.
Yes. Oh, 3 mistakes.
3 mistakes which will make you make the patient uncooperative.
Okay.
First is don't talk too much. Okay. You can talk to the point, but don't talk too much. Child will get irritated. Obviously, they think of so many imagination.
As answering 3 mistakes that you should avoid when dealing with pediatric patients. With the
child. And next is unmaya business. Okay. So that we gain the trust from the child and be honest. Child will thank you for that. The third thing is like don't try to accommodate the child for your clinic, make the clinic competitive all the time. Without me.
ஒரு 4 பேருமே எனக்கு ஷார்ட்டா 3 பாயிண்ட்ஸ் சொல்லுங்க. 3 Monday morning changes that you would write.
ரொம்ப டைம் ஆயிடுச்சு. As a cardiologist or caries prevention method, I'll always say caries management by risk assessment. நம்ம வந்து caries manage மட்டும் தான் பண்றோமே தவிர ஏன் அந்த TK வருது like the other patient as you told the continuous patient caries but the caries was managed but we have to sit and talk and understand why the patient is having recurrent caries. There should be some factor which is acting and the factor illama definitely recurrent caries varadu. So diet mattumdan illa, there are other factors also, probably salivary flow, all that has to be xerostomia sometimes.
She used to keep food on mouth.
So pouching, pouching of food, all that. So that habits, so adella nam analyze panni slower. If it is habit, we have to break the habit. Or if it is some other condition, if it is xerostomia or something, that has to be addressed. Or some systemic conditions could be there. So more than managing alone, we need to assess the risk and then address the factors which are contributing to the risk. So I think now the world is towards preventive protocols. So we now stress more on risk factors and risk assessment. So that is one thing which has to be concentrated in our day-to-day practice is what we feel now.
Sir, more clinically oriented. Number 1, have good instruments. You know that this instrument is mandatory, please invest and get it because that makes your work easier. Especially when you're going for rounds for kids or root canal, whatever it is, either it is handmade or whatever it is, and do not overuse. It will create a bad. You offset பண்ணி அமைச்சிரலாம், but one day it might turn back. எல்லாருக்குமே அப்படி cross பண்ணுமா அப்படிங்கிறது தெரியல, but it will. And take preoperative and post-operative. Only 3 points which I have.
Super.
I would stick to one point. Be inclusive. Try to accommodate everyone in your clinic. Any type of patients. You must be treating with a family. So try to learn new things and try to incorporate in your clinic, which will enhance their experience good in your clinic.
In pediatric dentistry, actually there are guidelines and protocols for every condition. There for caries management, for deep caries management, for pulpectomy, pulpotomy, for trauma, எல்லாத்துக்குமே guidelines இருக்கு, established guidelines. And there are protocols also. They are very easy and established ones. So what I would recommend is, as a child comes in, do not get started. என்ன பண்றது அப்படிங்கறத விட, if you have all these protocols ready in your clinic, it becomes much easier for you. எதுக்கு ஸ்பெஷலிஸ்ட கூப்பிடணும், எதுக்கு நீங்களே அட்டெம்ப்ட் பண்ணலாம், all that will be there in the protocol. So have a protocol set in your clinic for each of the conditions. So it's very simple. 4 conditions தான் இருக்கும் for pediatric practice. Just have a protocol ready.
Thank you very much, sir.
Thank you.